Hi, I'm Lloyd. I'm a sports medicine physician here at Swedish Medical Center. I specialize in sports medicine and also in physical medicine and rehabilitation. I also do electrodiagnostics here at Swedish. I like to try and incorporate humor into my patient interactions. I try to be very calming in my demeanor. It's exciting to be offering people procedures that I think are on the cutting edge of what sports medicine and musculoskeletal care has to offer, and to be able to provide people with relief or solutions to their problems that they may have sought from a lot of different providers prior to coming to me. The way that I see my relationship with a patient is really, again, as a two-way street and as a relationship. It's not as me telling them what I think they should do, but listening to what they have to say and listening to the story they have to tell me, and then framing the potential solutions that I have in the context of those things and helping them to make an informed decision about what they think is the best next step there. More often, my goal is to really try and come up with 2, 3, maybe more potential options for someone, and to help provide them with the knowledge and understanding that they need to make an informed decision about what the best next step for them might be in the context of all of the other things going on in their life. Everything that we do in medicine centers around the context of what someone actually wants from medicine and wants from the care that you're providing to them. And doing something to someone or for someone that they don't really want is kind of a pointless activity, and that listening to a person and understanding what their values are is a much more profound and impactful way to help someone. I think that there are a few really exciting things happening in the field of sports medicine and musculoskeletal medicine right now. Over the course of the last 10 to 20 years, we've made big strides when it comes to using ultrasound as a tool to be able to image the soft tissues of the body and other areas. And so as a result, we can, right in the office when someone comes in and is describing a symptom, get a history, do a physical exam, and then use ultrasound to better pinpoint and diagnose what it is potentially causing their symptoms. I think what's nice is that you really can get an end-to-end experience when you come to Swedish, that you can come and see a provider who can provide you with a full spectrum of services in relatively few visits. And if that person doesn't feel as though they have all of the tools they need to provide you with the help that you need, that they have several other colleagues who all are well experienced in what you might need next, and they can refer you to those people who are also well resourced and have some of the best knowledge in the field. One of the biggest parts that I enjoy in my job is working with athletes. I grew up, as most people do, kind of doing a lot of different sports, and I think both the experience of being an athlete and also the experience of being an injured athlete helps me to really relate to my patients. I also have a background in physical medicine and rehabilitation, and because of that, I've spent a lot of time working with people who have disabilities, whether it's that they had a stroke in the past and maybe a side of their body doesn't work, or they've had a brain injury in the past that prevents them from being able to think in the ways they want to, move in the ways they want to. And I think that those populations really benefit from physical activity, but oftentimes have been left out of the popular conception of what it means to be physically active and what it means to do sport. Working with athletes on how to adapt sports to think in different ways about their own physical activity so that they can return to sports that maybe they previously enjoyed, or to start sports that they may not have ever envisioned was something that they could potentially participate in, is also something that I find really exciting.